Brian Hollenbeck joins us now from New England Baptist Hospital, where he is the chief of infectious disease. Dr. Hollenbeck, thanks for the time today.
Thank you.
All right, so we've been watching the numbers. We get them every day. Governor Baker says our 7-day average for positive tests is now at about 2%. I think 1.9 is the exact number, up from a couple of days ago where it was at 1.7. Small compared to other states in the South and West, but what's more important here, the number or that upward trend?
Well, the trend is more important. The number itself means that about 1 in 50 tests is positive right now, and that's significantly better than when we were in the surge in April, seeing about 1 in 5 positive tests. But we are starting to see a positive trend going upwards, and it's been consistent for about a week or so. So it is something that we need to keep a very close eye on.
Well, as you mentioned, about a week or so, we recently had 4 straight days, a good chunk of last week, with more than 200 new cases of COVID-19. 273 was the number yesterday. Hasn't happened since June. And yesterday, the president of the Mass Medical Society tweeted this: "The data is early, but it looks like we are on the way back up. We should consider backing down a phase, a reopening phase." So why is the timing of a decision like that so critical? It would mean, of course, no more indoor dining at restaurants, the closure of things like indoor gyms and fitness centers. What do you think?
Well, I think that's something to really take seriously, and we have to look at these numbers pretty closely. If we wait for the metrics that we know matter the most, like deaths and hospitalizations, then those are lagging indicators. So things will have accelerated and be a little bit harder to control if we wait for those kind of metrics. So we need to look at the moving average of cases and the percentage positive. And if we see that that's increasing, then we do need to act on that to avoid having a worse problem later.
Governor Baker announced today that he will expand free testing to 8 more communities across the state. How could this effort help stop the spread?
Yeah, that could be very helpful. One of the big ways to control COVID-19 is to do contact tracing of positive people and to make sure that testing is available for anybody with symptoms or anybody that may have been exposed. So the more we make that available and the easier it is to get to, then the better off we'll be in controlling this.
Dr. Brian Hollenbeck from New England Baptist. Dr. Hollenbeck, thanks for your time today.
Thank you very much.